Hi everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. I am so pleased to have an opportunity to present a part of our research in this international conference by video session. Today, I will talk about nurses' mental health and focusing on their working place, which are hospital, nursing home, and home health care. Mental health is recently more and more concerning. Everyone wants to keep their mental health good. Thus, numerous researchers are interested in how we keep our mental health good. What is mental health? I know, of course, everyone would have already been known what is mental health, but ahead of my presentation, I would like to make sure its definition. Defining mental health scope, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choice. Mental health is important at every stage of life, from childhood, adolescence, through adulthood. So it means that definitely good mental health status needed for everyone for better performing in their work life. Nurses is one of healthcare profession predominant health workers and are dedicated to keep and promote people's health. Nurses have multiple roles such as care, educate, advocate of patients and their family. Additionally, their target is not only patients but also groups such as school students, industrial workers, and office workers. Nurses are delegated to the robust role of maintaining or promoting people's health. Therefore, nurses are also required to maintain good health status themselves. However, regrettably, nurses are often reported low mental health status. In previous study, several studies reported that nurses' poor mental health status. Additionally, nurses' low mental health is related to the occurrence of occasional medical errors or concerns about impeding patient. Regarding predicts of nurses' mental health, high job stress deteriorates the mental health of nurses. Job stress includes low workload, role insufficiency, role ambiguity, role limit, responsibility, the physical environment, high psychological job demand, low job control, and low job support. However, nurses' mental health status is not affected by work-related stress alone. A study from South Africa reports personal stress, which includes family-related stress, predict nurses' mental health status more than their work stress. Also in Japan, reports and that nurses who had a child indicated lower level of mental health than nurses who did not have a child. This might be attributed to family demand. The most representative studies stress factors relating work and family is concept of work-family conflict. Work-family conflict arises from competing responsibilities to work and family. It is composed of work interference with family and family interference with work. Work-family conflict negatively impacts nurses' mental health. Therefore, nurses' mental health status is influenced by both work and family-related stress. The burden of family demands varied among nurses of different ages. Young nurses aged 30 to 40 are often responsible for caring for their children, whereas nurses aged over 50 do not require a long period for child care. At present, Nurses work in a range of healthcare settings such as public health, home healthcare, or as nursing resident. Most graduate nurses primarily workplaces are hospitals. However, as home healthcare nurses are required to have more nursing experience when they begin providing home health care. Their mean age is older than that of hospital nurses. Moreover, several nurses who previously worked in nursing homes find employment at hospitals and therefore tend to be older than hospital nurses. Nurses' generation varied among the healthcare settings, which may explain the difference in nurses' family-related stress level between healthcare settings. Therefore, we esteem difference would exist nurses' mental health level and its affecting factors in between hospitals, home health care, and nursing home nurses. This study aimed to identify whether difference exists on degree of their mental health and its affecting factors by comparing hospital nurses and home healthcare nurses with nursing home nurses. Research questions are shown on this slide. We have two research questions. Number one is that does degree of nurses' mental health vary with between in hospitals, home health care, and nursing homes? Number two is that do affecting factors to nurses' mental health vary with between in hospital nurses, home health care nurses, and nursing home nurses? Data were collected from nurses working at hospitals in home health care and nursing homes in the Kyushu district of Japan. We analyzed 1,461 valid questionnaires. The breakdown of it was 596, 408, and 457 were hospital nurses, home healthcare nurses, and nursing home nursing, respectively. We achieved to get required equal samples for comparative surveying. We measured nurses' job control, job demand, and job support by applying Japanese version of job content questionnaires and measured the level of participant work-family conflict by using Japanese version of work-family conflict scale. We measured the degree of participants' perception that their organization understood their family role as work-family culture, and the frequency at which participants felt stress in interaction with their family as family stress. And we measured the degree of participants' level of mental health by using Japanese version of General Health Questionnaire 12 as dependent variables. Each higher score indicated low mental health status. We applied one-way ANOVA to identify difference of degree of nurses' mental health among hospitals, home health care, and nursing homes. Then we used hierarchical regression analysis on each groups to identify variables affecting nurses' mental health. And this is the result. Nurses in hospital experienced significantly highest job demand among these three care settings. Home healthcare nurses perceived significantly more job control than hospital and nursing home nurses. And home healthcare nurses also recognized significantly more job support than hospital and nursing home nurses. Next, regarding nurses' family stress factors, such as work-family conflict, hospital nurses indicated significantly more work interference with families than home health care and nursing home nurses. And there was no significant difference in family interference with work scores between the groups. The level of mental health among nurses in home health care was significantly better than among hospital and nursing home nurses, and nursing home nurses indicated significantly better score of mental health than hospital nurses. Next, variables affect to nurses' mental health were shown from bigger effect to smaller effect. Hospital, home healthcare, and nursing homes. And job demand, family stress, and job demand most strongly predicted nurses' level of mental health in hospitals, home healthcare, and nursing homes respectively. Next is discussion. Nurses' mental health status level varied in between hospital, home health care, and nursing homes. Home health care nurses indicated the most goodness mental health status. In contrast, hospital nurses showed the lowest score. One possible reason of this result was that job demand. Home healthcare nurses show the lowest job demand score among these examined care settings. Job demand, the strongest predictor of entry of target nurses of this study. May therefore difference of nurses' mental health level would be attributed to difference of job demand level. Regarding affected variables to nurses' mental health, examined 3 care settings showed varied results. Both hospital and nursing home nurses' mental health are the most predicted by job demand. However, home healthcare nurses' mental health are the most affected by family stress. In Japan, nurses who prioritize their work-life balance have been shown to tend to prefer to work in home health care. Many home health care nurses in this study perceived their family role as important. Therefore, it is reasonable that their mental health would be affected by work-family culture and family stress. In conclusion, degree of nurses' mental health was varied with between in hospitals, home health care, and nursing homes. And affecting factors to nurses' mental health was varied with between in hospital nurses, home health care nurses, and nursing home nurses. Our results show that family-related stress factors influence nurses' mental health. However, implementing intervention of reducing family-related stress may be more difficult than reducing work stress. Nevertheless, the result of this study clarify the need for certain intervention by nursing managers. To create a positive work-family culture, nurse managers should ensure that nurses perceive that their organization understands their family role and that the nursing manager do indeed have concern for staff nurses' family roles. If nursing managers can sympathize with how their nurses struggle with juggling work and family roles, this could foster work-family culture. Our result also indicated that this intervention would be especially effective for home healthcare nurses who showed no significant effect of work stress or work interference with family. Thank you for your kind attention and thank you for listening to my presentation and thank you very much for providing this opportunity. Thank you very much.